So hi guys, welcome back again to the channel. In first video of this series, I talked broadly about the reasons about why you should be choosing the OB-GYN residency if you are thinking about it as an option. In this video, I'm going to talk about the first month realities after you have joined the residency. So from now onwards, it is about after you have joined the residency, what things you are going to face, what things you are going to expect, and how you are about to go to towards these realities. So in this video, I'll talk about the first month reality. Okay, so let's begin. The first month reality is the most relatable part of every residence because every resident who is a senior resident now or a consultant now, everyone remembers how overwhelming their first month of the residency was. So I'm gonna talk about all the realities you are gonna face in the first month of your residency. Okay, just remember nobody feels ready on day one. You may feel very exciting after going to to the department, to the ward or the labor room on the very first day of your joining in residency. You can be very amazed. Like when I joined for the first day at AIIMS Delhi, I was very amazed seeing all these high risk cases, seeing all these, rare cases in the labor room. But then the reality settled in. Uh, I felt I was not ready for this. And trust me, you'll also feel the same that you are not ready for this. But uh, it's okay. You can. Just trust me, you can. Just take one day at a time and you can. So let's begin. I'll talk about, 7 to 8 realities one by one. So first one is information overload. In the first month, there is so much of, information overload that uh, you will feel so overwhelming that you will not understand what to do or what not to do. Why there are information overloads? Because there are departmental protocols. Suppose a patient comes and one resident is telling to other, do this, send these samples or fill up this form or do this workup or put these notes, and you will be, you'll be confused about what to do, what not to do, what you are expected to do. Many people will tell you work at one time, and you will be puzzled what I should do first, what I should prioritize first, and you'll be very much confused about what is going on, how the system is working. So there are departmental protocols everywhere, wherever you join residency, and there because there are protocols, there are so much of information, and you will feel overwhelmed in the first month. So that is, very much expected. Then there are some documentation and paperwork, like taking consents, doing workup, charting investigations, charting treatment. You will be confused about those, how to do, what to do, where to write, when to write, who is supposed to write, who is supposed to sign, who is supposed to follow the orders. So these will make you overwhelmed. There are labor room workflow. So like in my first day, I was posted in labor room, and I just watched that there will be labor room workflow in a certain way about when a patient comes, how to admit, what all to write, whom all to inform, what to send, how to document, and everything. Again, there will be ward management when a patient gets admitted to ward, how to do workup, when and where, and how to send investigations and everything, consent and everything. There will be OT procedures, there will be, pre-operative managements like charting medication, doing PACs, pre-anesthetic checkups, taking consents. Uh, there are some hospital protocols regarding this pre-op management, so you will learn with time. Then there are duty schedule. You will be confused when is OPD, when is OT, when is major OT, when is antenatal OPD. when you are being put in rounds, when you are off. So you'll be confused about duty schedules also in the start. Then about the referral system. Suppose a heart disease patient comes and she has some complications while being admitted in your ward, then you need to contact with the cardiology team about the further management, then how to send referral, how to follow them. So these are all the information overloads which will make you feel overwhelmed in the first month. And this happens with everyone. Trust me, this happens with everyone. One, and not only in the first month, it may persist till 2, 3, 4, 5, 6 months. It may persist longer or shorter for someone, and you know, uh, but that's okay. This happens with everyone. You are not the only one with whom this is happening, and everyone goes through it and they learn with the system. You will also learn with the time and the system. So just give yourself some time, give yourself some, you know, space for it's okay to not know everything on the first day. You are a human, na? You are not a robot or a machine that you will just get to know and you will just recognize the system in one day. Sometimes it takes year to, to get settled in the system, and that is okay. Hmm. So in the first month, you will feel that remembering where things are. Suppose if you are to take blood sample of a patient, you will be confused where are the vials, where are the syringe, where to discard it or not. So mostly you will be confused where things are and whom to call than remembering the medicine itself. So you'll be confused where are notes, from where to take the referral notes, from where to take the doctor's note, where to give this, that. It's okay. It happens with everyone. Just bear with the time. You'll be fine. The second reality is labor room is intimidating. It is intimidating and it is gonna make you feel intimidating. And that is okay. Initially, you will struggle with interpreting labor progress. Suppose you are in first month in your labor room posting. You just joined and your consultant has put you in labor room for 1 week or 2 weeks or a month, and you are just confused because you thought you will get time to study, but you haven't got time to study, so you don't know much about the labor, about how to monitor, how to assess. If you have not done that in your internship, if you have not, seen properly in your internship, you may feel overwhelmed with the labor process. You may feel you don't know anything. You may feel that okay, they are monitoring in a certain way and you're not understanding how the things are going. So this is very overwhelming. You will not be able to perform vaginal examination, confidently if you have not done enough in your internship. So please do your internship properly in OBS and gynae if you are willing to take OBS and gynae. Okay. So you will be confused about when to call your senior. Suppose your senior told you go monitor the contraction of that patient and just keep monitoring the CTG of the patient. Suppose one deceleration came and one deceleration has come and you are not able to identify the deceleration. You thought it is early, but it was variable, and then there was some poor outcome, and then your senior will scold you, and you will think you don't know anything, but that's okay. Sometimes mishap happens, sometimes we confuse things, mostly in earlier part of our training, and it will not happen every day. It may happen sometime. You may be scolded so much for this. You will feel I have come to the wrong place. I have done the wrong thing by joining this residency. But time will heal everything. Trust me. It happens with everyone, and time will heal everything. You will be confused and you will struggle so much about managing so many patients at a time. In labor room there are so many patients, and one patient is in labor, one patient is admitted with eclampsia, one patient is there for PPH management and is there admitted there after PPH management, one patient is for BP monitoring, one patient is for labor monitoring or TOLAC. maybe going on vaginal birth after cesarean, maybe going on. So there are so many patients in labor room, and you will be confused and struggle with which patient to see, how to remember what is going on with every patient. So you will struggle with this. But just trust me, it will gradually become routine. Okay. First, it will feel very chaotic. You will feel that labor room is like a mashli bazaar, and there are so many, shoutings going on here and there from doctors, nurses, patients, babies from everywhere. But with time, gradually, you will learn all these things. You will learn about monitoring labor, about, doing PB confidently, about calling your seniors when needed. So you will do this with time. Okay, just give yourself time and you will just get into routine soon. But don't expect to get into routine in the first month itself. It is very rare. I did not get into routine in the first month. It took me 6 months. So for someone, it may be 6 months like me, but for someone, it may be 1 month if you are lucky enough. Okay. Third thing is that the learning curve is very steep. It is very steep. First, it can be like this, slow. If this is the graph, it can be this slow, but it will be steep at some time. The only difference is time and experience. So initially you may feel like, okay, your seniors, seniors or your senior residents are so much efficient. They know everything about every patient. They are so quick in their management, in their reflexes. So you will feel, okay, they are so smart, so efficient, and I am so dumb, so non-efficient. I don't know anything. I am not able to study. I'm not able to sleep. I'm even not able to manage patients. So I'm useless. You may think like this, but this is not so. Okay, you are just a first year resident in the first month of your residency. Just remember this. Just give yourself credit enough to come to the ward or to the labor room every day despite being exhausted. Okay, so you may feel slow during rounds. Suppose consultant is taking rounds, they are talking, consultant and your seniors are talking about patients, about okay, how to manage, and you are just confused what they are talking. So that is normal in first month. So it's okay to be slow. Okay. Your consultant may tell you, okay, present this PNC case. And when you start to present, they may, just snap back at you for why you did not tell this, why you did not say that, why you did not inform me about this or that. So that is okay. You are not perfect, na, during your first month. So that is okay. You may be hesitant in emergencies. Suppose you have gone to take round for a PNC patient just after delivery and there is PPH, and you are just confused about why there is so much bleeding. You forgot to call your seniors. You just took time to call for help. So that may happen in the first month. That should not happen, but that may happen because we don't know the protocols, na. We don't know all the things, all the steps in managing emergencies or anything. You will be overwhelmed by the workload, and that is okay. You know, so don't feel underconfident. So don't feel inefficient. Don't feel that your seniors are so much efficient, but you are not. There is a difference. There is a difference of time and experience between you and your senior. So when you become a senior, your junior will see you and they will think the same, that okay, my senior is very much experienced, my senior is very much smart and efficient, but I am not. It happens with everyone. It happened with me. It happened with my seniors. It happened with my juniors. And that is okay. So the difference between you and them is experience. Okay. Now, the fourth thing that people just forgets before joining residency, that they are going to say goodbye to their sleep routine. It happened to me like when I was preparing for this INI or NIC PG. I took some break in between, before the exam, and I was in my home, so I was chilling. I was sleeping in my own time, waking up in my own time, studying in my own time. And after I joined residency, there was a 360-degree turn. There was no time to sleep on my own. There was no routine of sleeping or waking up. I had to just go in for the ward at 6 and come back at 10 or 12 or 2 a.m. also. So there was no time for proper sleep. And this happens with everyone. Just trust me, everyone. There will be night duties. And after night duties, in most places for junior residents, there are, you have to continue the duty in the next day, be it OPD or OT. Then there are unexpected emergency surgeries. Suppose your night shift is gonna end at 8 a.m. and just at 7:50 a.m. one emergency came. You cannot just go by leaving that patient. You just cannot hand over to other team. If there is gonna be a surgery, emergency surgery at 7:50 a.m., you have to scrub in, and it can go till 11 or 12 or 1 o'clock, and you have to stay there. So sometimes this happens and it feels very bad, but this happens. So there are no schedule, sleep schedule. There are busy labor room shifts. Sometimes you are doing night continuously, na, back to back, and you think, okay, sometimes if patients are less or no patient comes in emergency, I may doze off for some time, but it may not happen so. Okay, it can be very busy, very busy. In the first month, this is the most important thing. Physical, in the first month, we realize as a resident that physical endurance matters almost as much as or even more than the academic knowledge, because you know just standing up, just enduring all these physical hardships is much more than the academic knowledge. Okay, so just bear with it, you will be fine. The fifth thing is, you will make mistakes. Like everyone make mistakes. No one is perfect. No matter what your senior tells you that, oh, I did not make these mistakes like you, I was not as dumb like you, I was not, as much as inefficient like you. Don't trust them. Everyone was same in their first month. Everyone was confused. Everyone was, inefficient as per them. Everyone was feeling dumb, everyone was feeling lost, everyone was feeling sleep deprived, everyone was at same stage during their first month of residency. So don't trust anyone who does not say so. Okay, don't trust your seniors if they don't say so. You will, while taking history in first years only, you may be asked to take histories like we used to be asked. Now, when a patient comes, you have to take history, full history, and you may miss something. You may miss some important past histories or important past surgeries about the patient or important family histories about the patient. You may not, do proper documentation. You may have forgotten to write the summary at the end of history taking. You may have forgotten to write about the differential diagnosis. So there may be, you may have forgotten, taking the consent properly. So there may be incomplete documentation. You may have forgotten to send important investigation of for a patient. Suppose a hypertensive patient was admitted in your ward and you forgot to, a preeclampsia case was admitted and you forgot to send urinary protein. So you may be scolded for the same, but that's okay. We forget and then we get scolded, and that's how we learn to not to forget next time. Okay. There may be again delayed communication with your seniors. You may be, delay in asking for help like I did. I was very reluctant in communication, in asking for help from my seniors. Sometimes I thought, okay, what they will be thinking about me, that I don't know even this basic thing. Sometimes I was scared to ask, like we all are, but this happens with everyone. And again, I'll say the same thing, give yourself time, you'll be fine. Just remember, the goal here is not to avoid every mistake. Mistake will happen. Some will make 10, some will make 20, some will make 2. But mistake will happen with everyone, from everyone. Okay. But you learn from them. You learn from all your mistakes and try not to repeat it. Sometimes you may forget it again and repeat it again, but try not to. Okay. and develop safe habits like communication, like asking for help, like proper documentation. So develop these habits. Okay. So next thing is depending on your team. Residency is not an individual sport. Just remember it is a teamwork. Okay. And one of the most valuable and the most important things is residency is to realize when to ask for help. That is the most important thing, asking for help. You cannot do everything alone. You cannot manage every patient alone. You have to ask help from your seniors, from your consultants, and even from your juniors. Okay, from the nursing staff, from the Sulabh staff. So everyone is there to help you. Just ask them in a proper way, in proper manner. Treat everyone nicely, and they will help you. Like I remember in my first year, I was so much food deprived and sleep deprived, and I used to roam hungry. And everyone knows that first year residents are hungry people. So my nursing officer used to just call me in their, nursing rooms, and sometimes they used to give me foods, and they will just tell me, okay, sit and eat because they know I'm hungry. So they are also very kind. Sometimes you may feel not so likability from them, but most of them are kind because they know how you feel. You are away from your home, from your parents, mostly from your friends. You don't know anyone in this new place, so they know that you are lost, that you are overwhelmed, and you are very scared. So many people will come and help you. Not only nursing officers, your seniors even. Most of them sometimes they are also there to help you. Sometimes you will get good seniors. Most of the time they are toxic, but sometimes there are many good seniors also. So just recognize those good people and ask for help from them. Okay. And for patient management, no matter if your senior is toxic or good, you have to ask help from your seniors. Okay. The next thing is academic will take a back seat initially. You may think before joining residency, okay, I did a good rank, so I joined. Like I thought, कि, okay, I am a good student. I had a good rank, and I joined AIIMS Delhi. So I might be, learning from the first day itself about obs and gynae. I bought books and I'll start reading. But it was not so. In my first year, not only 6 months, in my even whole first year, I could not get time to read properly. And it took me long to understand that reading and learning is not from books only, it is from my patient also. In the first year, it is mostly from your patients and surrounding. Even if like we think most of the works in first year is clerical, like you are sending blood samples. In our hospital, we residents have to withdraw the blood sample and then print the barcode and send the blood sample. But this is also a learning. Suppose you are sending bile acid for an IHCP patient. So learn from there, na? Why are you sending? How frequently are you sending? How you are interpreting the results? How the results are changing the management. So that is a learning in itself, which we don't realize in long term. But if we do these clerical things even in a proper way, we are already giving our time and effort in doing that thing. So give your heart also, give your some mind also. Try to be selfish in learning also. If you are doing one work, try to learn maximum from that work. Okay, it's okay. You do all this paperwork, cut work, that is okay. You have to do. There is no other option. But try to learn from that. Don't let that go into waste. Okay. So the first few weeks are about survival and adaptation. Even the first few months are about survival and adaptation. Don't think that you will learn from great books. You will get time to make notes. You'll get time to study from books. It is not. Most learning happened through patient care, and it is very true. Your structured studying becomes easier once you settle in the workflow. So give yourself some time to settle in the workflow, know about the routine, departmental protocols and routines and schedules and everything. And then you go into structured learning. Till then, learn from your patients. Okay, learning from patient is for lifetime, but for that time being, just learn from your patient and don't run behind books and notes and videos and lectures and everything. Okay, many new resident centers with ambitious studying plan like I did, but it did not work out for me. It doesn't work out for many of the residents, most of the residents, I say. Okay, but don't be overwhelmed. You will learn with time. Uh, the eighth point, the turning point is when after few weeks or few months you start seeing changes in yourself, in your surroundings, in your routine. You know about the ward routine, you know about the labor room management and assessment of the patient. It becomes easier for you. You become more confident. You become more confident asking for help, calling your seniors for help, and for any doubt in case. Okay, you stop feeling lost all the time. Initially, you may feel lost all the time. Everyone feels lost all the time initially. I also felt the same. But it will settle, the feelings will settle after some time. Okay. The first month is not about mastering OBS and GYN. It is about adapting to the residency life. It is very hectic. So give yourself time to adapt to the life. Don't think about academics. Don't think about, okay, why my life is this, why my life has become hell. It won't be so for long. You will come into the routine, you will know about the protocols, you will know about how the department runs, how to manage a patient, and you will be fine. So my closing message will be that the first month of residency or the first few months of residency will be overwhelming, will be exhausting, will be intimidating for you. But just remember, when you see a senior of yours, or when you admire any senior of yours or senior resident of yours, that okay, she is very efficient, she is very smart, she is very quick in managing a patient, she is very knowledgeable, she is very up to date with all the updates in the subject, and you know. So just remember, she was once you, she was once at your state in her life or in his life. You are not just dumber version of yourself. You are just you know a, a version of yourself which will not be so for in the upcoming future. So just remember, when you admire a senior of yours, someday you will be that one senior which will be admired by your junior. Just give yourself time, just give yourself space, just give yourself, just be grateful that you are alive, you are in a residency of your choice, that you have got a seat, that you have a job, and that you are learning from your patients, that you are able to, you are able to manage a patient. And, life is very big, life is very great. Residency is just a part of life, it is not your whole life. This will be very overwhelming. Just ask for help whenever you feel like. Don't be depressed all the time. I know there will be depression for some time, but try to ask for help from your seniors, or even you can discuss with your parents if you want to. I'm not telling just take all these disgusting first month feelings over yourself for for forcefully. Like if you feel like you don't belong here, give yourself some time to rethink about it. And even after that, if you feel like you don't belong here, that's okay. You can leave. Residency is not the only part of your life. You may change your subject, or you may change your field, whatever. Like many of my co-residents, they resigned and they joined other specialties like derma or radio, and they are happy in that branch. Many of my juniors, they left the seat, they took a drop, they again studied, they again joined in some other specialty in a better college, and they are living happily ever after. So all these hardships are worth, if you feel that this residency is what. you want. Like I wanted OBs-GYN. I loved this subject so much. So that is why took all the hardships. So if you love it enough, try to take the hardships. It will be fine. But if you think like you are not able to take, just ask for help and you can take off also if you want to. I'm not here to demotivate you. I'm here to tell you that there is hardship, but hardship is not the only thing in the world for you at this moment. Okay, so take care and thank you for watching this video and stay tuned for upcoming videos. Thank you.